Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each month, we deliver informative health and wellness topics you want to know about, so make sure to subscribe to us on your preferred podcast platform. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPA Cares. Now here's your host, Chief Executive Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and with me is
Maddie Norton.
Maddie. I didn't say as always because last time I did the recording on my own. I didn't
I
make you sit
know.
through 45 minutes of me talking about Medicare.
It would have been okay if I had to, but you did a great job by yourself, and
Oh,
I hope you didn't miss me too much.
well, it keeps us on track with Medicare March.
It
I hope
does,
people will go and watch that video. Yes, you can listen to it, but it's definitely better with the slides.
for sure.
Um, and we've got programming all month, both about
hmm
Medicare, but I think there's some other things going on too, right?
Yes. So this month we have, and we're talking about March. This video will come out on March 23rd, which is a Monday. And so the next day, Prudential is hosting a webinar about Social Security benefits. So if you have questions about that or just want to tune in, there is three separate times that you can sign up for, and it's all on our events page, which will be linked in the description. But you can watch at 8 a.m. Eastern, 1 p.m. Eastern, or 6 p.m. Eastern. So register for that if you are interested. And then coming up in April, we'll have a financial wellness checkup on the 15th, and you can secure 30-minute time slots to speak with a financial advisor just about potential goals or any questions you have. So definitely check that out and sign up. And please sign up a week in advance, or closing or registration for the financial wellness checkup will close a week in advance before the actual date. So make sure you sign up. Don't wait until the last minute, and check that out. And then on the 21st of April, we're going to have another webinar, which is called Is Your Financial House in Order? So lots of, I know, the scary question, especially right
Yeah.
after tax season. So if you have any questions, definitely check those out on our events page. And as per usual, we have AFSPA Live at the end of this month on the 26th, 11 a.m. Eastern Time. If you can't make that, don't worry. You can watch all of our AFSPA Live events on our YouTube page at AFSPA Cares. And if you have a question that you want answered, submit it. We'll include the link in the show notes for the form, and we'll make sure to answer it. And it's all about Medicare, if you weren't
That's
aware.
right.
It's because it's Medicare March. So
That's right.
keep a lookout for that. And then also, we will have another podcast episode coming out at the end of the month. So keep your eyes peeled, or your ears peeled, I should say, for that.
Either way, however you choose to tune in.
Yes.
But today we're revisiting a topic that we've talked about several times and that we spent some time on in October and November for open season, and that's prescription drugs.
Yes.
Um, so
And
today, ASPA talks Medicare PDP. That's our prescription drug plan under Medicare. And 30 years ago, Medicare beneficiaries had fewer options to cover their prescription drug needs. Of course, there were fewer drugs on the market at that time, but a lot fewer options for people to pay for those other than out of pocket.
absolutely. And for some of us who may not be aware, Kyle, can you dive into a little bit about the evolution of coverage?
Yeah, I fed you that question
Yep.
because I doubt you or many of our listeners dive into the details about this in free time like I do. So I will try to keep this brief. There were changes in federal legislation in 1997 and 2003, and those both greatly expanded the options available to Medicare beneficiaries, particularly with the launch, what eventually became the launch of Part D, as in drug plans in that came about in 2006. So happy birthday, 20 years old, Part D
Yay.
coverage.
Happy birthday.
But it wasn't available to federal employees to have that as part of their FEHB coverage until in 2023, the Office of Personnel Management changed their guidance. They said that FEHB plans could allow this. Of course, they let us know in January. We at least had time to make those changes for the following January in 2024. Um, And I will just note that actually Postal Service Health Benefits Program split out. They have to have Part D coverage. FEHB enrollees, like Foreign Service Benefit Plan members, have an option. So too long, didn't read or didn't listen, whatever however you're getting this. In
ELDR.
2024, FSBP partnered with Express Scripts to launch our FSBP Express Scripts Medicare Prescription Drug Plan, or our PDP, and it's for our members who are enrolled in Medicare A and or B, and it enrolls individuals in a Part D plan. And there were two similar goals in launching this: save individuals money and save money for the plan overall because some of the pieces that are in place to do so. So members who opt into the PDP retain their high option medical benefits. So even if you just have Medicare Part A, we're still going to be primary for most medical. And you only really see with the PDP changes to your prescription benefits. So let's dig into some of the savings opportunities and other details with today's guest from Evernorth, Express Scripts, Tavares Johnson.
Let's get into it.
And Tavares Johnson, TJ, returning champion. Welcome back to AFSPA Talks.
Thank you. Glad to be here. How are you doing today?
We're doing well, although I got to be honest. First of all, it's always great to see you. We had you on very recently, just back in October, but I'm a little confused about some changes that some of our members have made because our members are spending more on prescription drugs than they need to, which is why we had to bring you back to try to get people to save themselves money.
Absolutely.
So I'm gonna sit here and stew in my confusion and let Maddie kick us off with some questions.
And, hopefully we can understand maybe people don't know a lot about the eligibility requirements for the PDP. So we'll start with an easy question. What are the requirements for enrolling in the PDP?
Sure. So the requirements are you need to be age 65 years older, retired, living in the U.S. or the U.S. territories such as Guam, Puerto Rico, U.S. Virgin Islands. You need to be enrolled in Medicare Part A and or B. You don't have to be enrolled in both. And you need to be receiving your group health coverage through your retirement benefits.
Yeah, and I think that last point, I thank you for including that because I want to clarify for some people. Let's say you yourself are retired, you're over 65, and you're the spouse of an active federal employee, and you've got your group health insurance, your FEHB, or in this case, your FSBP coverage through that active employee's group health insurance. Because that primary enrollee is still employed, you're not yet eligible for PDP. You would be eligible once you meet those conditions and once your spouse retires and you get that group health insurance through a retirement benefit. But we've had a couple questions come up about that. Now, I want to get back to my confusion, and we're going to try to dig out of this. Um, in January 2025, we had about 6,600 people who were enrolled in the PDP. I checked the numbers as of January of 2026. The enrollment was down by around 500 people. Fewer than 6,100 were enrolled. And this decrease in enrollment happened as we implemented increase in member cost shares under the high option prescription drug benefits. And even as our total enrollment in foreign service benefit plan increased. So, Matt, you make a good point. Maybe people just don't know what the eligibility is. They may not know that this program is out there. We're going to try to fix that today. And so to all of that, TJ, what's the number one reason someone might want to consider I'm going to use the full name here,
Yeah.
the FSBP Express Scripts Medicare Prescription Drug Plan, or the PDP?
I think the number one reason would be to save costs and save money. Some other benefits of enrolling in the PDP is you have a larger pharmacy network. You have more options. You're not locked into filling your prescriptions through home delivery or a particular pharmacy. You always have a choice as long as it's in-network pharmacy. Um, and again, to reiterate, it's just a better plan design from a cost saving perspective.
And, at the end of the day, we want people to save money because it is not cheap to live in America right now. So, prescriptions that can save you money would be great. So let's start with that part about saving money. I'll give a tier of drugs and ask you each to give the coverage amount. Kyle, you can share the high option. TJ, the PDP. For consistency, we're going to focus on 90-day refills. So tier one, non-specialty generics.
The high option copay is $20.
And under the PDP for a 90-day supply, it would be $4.
So a $16 difference. Tier two, non-specialty preferred brand.
Yeah, so this is one of the changes we made last year. Members are responsible for 35% of the cost of the drug up to a maximum of $300.
And under the PDP, that cost would be $60.
Yeah. All right. Tier three, non-specialty, non-preferred brand.
Yeah, so this also saw a change. Members are responsible for 45% of the cost of the drug up to a maximum of $400.
And under the PDP plan, the members' cost for 90 days would be $150.
Nice. All right. Tier four, generic specialty drug.
Yep, so members here on the high option, 35% of the cost up to a maximum of $240.
And under the PDP for specialty medications, the member has a flat copay of $150.
All right. Tier five, brand name preferred specialty.
And this is just me because, as TJ said, it's specialty are all one tier under the PDP. So for the brand name preferred specialty, members are responsible for 35% up to a maximum of $240, just like tier four.
All right. And then tier six is brand name non-preferred specialty.
Yep. And members are responsible for 50% up to a maximum of $480.
Yeah,
Nice.
and again, as Kyle was stating, there are only four tiers under the PDP: tier one, two, three, and the specialty tiers, tier four. Whereas um, under the
Yeah,
other plan, there's six tiers of medications.
Yeah.
that's right. But I hope that helped people to walk through it. But there's another aspect to the savings for the PDP, right? TJ, can you tell us a little bit about the out-of-pocket maximum?
Absolutely. So there's, I'm going to try to explain this without getting people lost in a simplistic way. There are two out-of-pocket maximums. There's one that AFSPA has, which is called a maximum out-of-pocket or MOOP. And then there's one under the PDP that CMS regulates, which is called a true out-of-pocket or TRUE. The ASPA maximum out-of-pocket amount is $2,000. And what counts to that is Part D is in David medications, non-D is in David medications, Part B medications, diabetic supplies, things of that nature. It's all encompassing. Under the PDP accumulator of $2,100, the only thing that counts towards that is Part D is in David medications. But the positive thing about this is that some of the amount that ASPA pays towards this PDP accumulator, um, it goes towards that. Whereas under the MOOP, if you pay $20 for a medication, only $20 is being added to that MOOP.
Gotcha.
And I just want to clarify that the Foreign Service Benefit Plan still has its catastrophic out-of-pocket maximum, but if you're enrolled in the PDP, we lower that total amount by $2,000, carve it out just for your prescription needs, and so your medical out-of-pocket is actually lowered by $2,000 depending on whether you're in self-only, family, or self plus one. So there are savings, there are potential savings not only in prescription drugs, but can also help on the medical side when it comes to your out-of-pocket maximum. Um, and just for clarification, TJ, you mentioned non-D drugs. I'm going to throw a little curveball here and just ask, can you give us some examples of non-D drugs that are covered as part of, I think we really refer to it as like a wraparound plan that we're offering. Um,
Absolutely. Yeah, so some non-D medications would be things such as weight loss medications, such as the Wegovy or Zepbound. Some other non-D medications are lifestyle medications such as Cialis. Those are just some examples of non-D as in dog medications.
and I appreciate that example of some of the drugs that are non-D but still covered by our PDP, because I just want to reassure listeners that any drug that is covered under the high option is also covered under the PDP and under this sort of wraparound approach that we have to it. So definitely check the costs on that. We've got cost calculators for both the high option and the PDP linked on our website, and we'll provide some links to those in the show notes. But definitely check that out to make sure that you know what you're paying and what's available. Um, we debated whether or not to include a specific example of a drug, but TJ, you pointed out that drugs can change costs, right? Because of supply costs, pharmacy to pharmacy, and so forth. And we didn't want it to come across that we were making a guarantee that people would pay a specific amount on a specific drug. Um, that said, I do plan to do a video this month and have it online. So check our YouTube channel, AFSPA Cares, with an example for a point in time, just to show you how to research the difference in the two costs, but not guaranteeing the cost that you'll see in that example.
Perfect. All right. Um, TJ, are there any other benefits to the PDP that people should understand?
Yes, again, just to bring it back all together, under the PDP, there's a wider network with more pharmacies. Your maintenance medications, members have a choice whether they want to fill it through home delivery at mail or if they want to go support their local pharmacy. Also, another big reason is the specialty medications. You could fill those at home delivery through a Credo, or you can go to your retail local pharmacy if they have that specialty medication in stock. And again, the one tier of specialty medications under the PDP versus specialty is broken out into three tiers, and the cap of $150. As we saw in the examples earlier when we were discussing, the cost share under the PDP in some instances, such as tier two, is 5 times less than it is under the other plan, where it has the maximum of $300 for those tier two items. So, you know, I would just add, if you have questions, feel free to reach out to our member services who can give you some prices, make sure your medication is covered. And we can also have some digital resources that you can go to check and make sure that your medications are covered and get your costs.
Absolutely. And just bottom line, you've got a lot more options, and most people can save money, even if they're subject to the IRMA. And again, in that example that we'll be posting on YouTube, I'll walk through exactly how to do that comparison and do the pricing out so you can understand, because it's going to be different for everybody. All right. Great journey down the PDP road again. TJ, before we wrap up, is there anything you'd like to add or that we might have missed in today's conversation?
No, just thank you again for the time and the opportunity. Really enjoy having conversation. I get excited talking about the PDP. I kind of live, eat, and breathe it. And looking forward to having continued conversations with you.
We do
All right.
too. Thanks so much for joining us.
Thank you.
Thank you, TJ.
Thanks again to Tavares Johnson of Evernorth for joining us. To learn more about the PDP and access the pharmacy locator and drug pricing tool, please visit www.afspa.org/PDP, or you can use the link in our show notes. You can also use the form on that page to opt into the PDP coverage. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the hosts and guests do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or other products offered by AFSPA and its partners, the policy provisions will prevail. Thanks for listening. Be sure to follow and subscribe to AFSPA Talks on your favorite podcast app to catch all of our future episodes. Please rate and review us on your favorite app, and stay up to date with all things AFSPA on Facebook, Instagram, and LinkedIn. Search for AFSPA Cares. We'll talk again soon.
Thanks for listening to this episode of AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live at 11 a.m. Eastern Time on our YouTube channel at youtube.com/AFSPA Cares. Thanks for listening.